Hello, everyone. Today I'm going to be discussing the public health issues of famine and the declining state of healthcare facilities in the Democratic People's Republic of Korea, also known as North Korea. Governmental restrictions pose threats to public health on the people of the country and hinder any potential growth in the country. The Democratic People's Republic of Korea holds 0.33% of the entire world population, with 25.5 million people. The country relies on the ideology of self-reliance, maintaining the idea and staying sequestered from the rest of the world. The single-party state or dictatorship run by the King family dynasty, also is known as the Mount Piku bloodline, has been in power since the formation of the country in 1948. Kim Il-sung was the first leader of the nation in 1948 until his death in 1994. He is known as the Eternal President and was followed by his son Kim Jong-il, who ruled from 1994 to his death in 2011. He is known as the Eternal General Secretary. Today, his son Kim Jong-un is the current leader of the nation, and in 2013, a new clause was introduced to the 10 fundamental principles of the Korean Workers' Party, stating that the party must be eternally carried by the Baekdu bloodline. The fate of the nation rests in the hands of its leaders, and the dictatorship has total control over the people. Strict regulations and rules throughout the country limit basic freedoms of the people of North Korea. The media in the country is among the most strictly controlled in the world. Although the Constitution provides freedom of speech and press to its people, the government actually prohibits the practice of these rights unless it has to do with praise of the country, the government, or its supreme leaders. Korean Central Television is the state-run TV channel pre-programmed to all televisions in the country. The network airs news programs and documentaries praising the country's leaders. Authoritative statements are also delivered through this channel, as well as approved revolutionary dramas, operas, and other entertainment programs. Radio stations and television sets are supplied pre-tuned to government stations. Radios must be checked and registered with the police as well. Some residents have purchased a second radio set in secret to listen to foreign broadcasts. Newspapers are all owned by the state. Internet access is reserved for a small section of an elite group who have received state approval. Only 4.8 million residents, which is 19% of the population, have a telephone, whether that be a landline or a mobile device. In the Constitution of North Korea, religious freedom is protected. However, those who practice various religions in the open are often prosecuted. It is reported that since 1953, at least 200,000 Christians have gone missing in the country, while it is believed that 50,000 Christians remain in these internment camps. If caught by the regime, unauthorized Christians may face torture or, in some cases, public execution. The government and its leaders believe the spread of Christianity is a severe threat to their power. Being one of the least open economies in the world, North Korea has faced chronic economic problems. It is estimated that 40% of the people live below the poverty line. Practicing the nation's ideology of self-reliance, the country typically shuns foreign investments and trade, although throughout time has seemed to accept aid from the Soviet Union and China. After the fall of the Soviet Union in the 1990s, North Korea had lost most of its European allies, but China had still given the country aid as needed. In 1992, China began demanding cash payments instead of its typical credit lines. In addition to this, during the 1990s, North Korea suffered from a series of natural disasters, including floods and droughts. Grain shortages resulted, causing starvation and malnutrition throughout the country. By the end of the decade, the economic situation improved slightly due to a massive influx of international food assistance. The country has maintained minimal contact with countries in which they received aid from. In efforts to lower labor productivity, Kim Jong-il paid very close attention to the military while opening parts of the economy to foreign investment and trade. In 2009, the country revalued the currency to 1% of its existing value. This eliminated virtually all savings people had accumulated, in addition to causing an economic crisis while shutting down markets and banning the use of foreign currencies. This caused a rate public protest by citizens. Food shortages have been present throughout the country since the 1990s. In this decade, a nationwide famine is thought to have killed somewhere between 240,000 and 3.5 million people. Records of deaths are difficult to find due to strict government regulations. The country accepted aid from various countries at the end of the 1990s, but very little. In addition to economic reasons for poor food stability, natural disasters such as floods, typhoons, and droughts throughout the years have impacted food supply in a negative way. 15% of the farmland was destroyed in a flood in 1996, which was already scarce to begin with. Childhood malnutrition continues to affect thousands of children throughout the country. The country was known to prioritize feeding the military over civilians. Some residents had resolved to eating grass or foraging for wild food to survive. Large quantities are reported to have crossed the border into other countries, such as China, in search for food, despite strict travel bans. Children are the most negatively affected by the lack of food. It is reported that 19% of children are underweight for their age. In the mountainous regions where half of the population of children live in the country, they are most vulnerable to food scarcity and an increased likelihood of chronic malnutrition. The country boasts its use of universal health care to its citizens, giving the illusion that proper care is given to its people. Under the laws of the nation, clinics and hospitals are assigned to provide services and treatments to residents in their designated areas. Providers, however, lack basic equipment and supplies. Physicians who have fled the country have been surveyed saying that the healthcare system lacks medical supplies and sound infrastructure. 25% of the North Korean population suffer lack of health access to essential health care. Risk of disease among infants and toddlers remain high, with 1.7 million at risk for deadly disease. Improper infection control is seen throughout the country due to the reuse of disposable pharmaceutical containers due to a short supply. This practice is widely accepted and encouraged by the government, which in turn increases cases of infection. There are a lack of antibiotics and improper blood transfusions, poor infection control, and the mismanagement of complications arise during procedures, all attribute to maternal death. Many people in the country have to turn to other markets for their basic medication needs. Consumers seek products with immediate symptom relief without proper guidance as to their administration or use. They are often uninformed of any potential side effects or ingredients, leaving potential. Facilities throughout the country lack basic needs to perform the simplest of treatments or even a simple consultation. Despite the nation's dire need for medical training, access to medicines, and public health education, the country has one of the lowest recorded per capita total expenditure on health than any other country in the world, failing to provide health needs of its population. The World Health Organization reported that the country spent less than $1 per person in 2006. It is evident funds are not allocated to improving healthcare facilities. Those who have experienced these facilities generally rate them as poor, having no electricity due to energy shortages. Physicians and staff often have to treat patients using daylight or candlelight. Unsanitary conditions are also common. Some operations are performed with anesthesia, however, oftentimes there is not an adequate amount, which cannot completely control the pain of the procedure. The government urges physicians to practice in unsafe conditions and requires them to practice in unsafe ways. Reusing medical materials that are supposed to be disposable and single use is common practice at facilities throughout the country. In addition, doctors often work without pay and have little to no medicine to dispense. Unofficial payments are often made to doctors from their patients. Illegal goods or sums of money are given to healthcare workers in exchange for treatment. Cigarettes and alcohol are also commonly given due to money being more of a risk for intense punishment. In addition, cooked food was recorded as payment. These unofficial payments are necessary in order for these healthcare workers to survive. Drastic changes need to be made regarding healthcare in the country for the sake of the people. Priority is first given to industrialization and the military over the general population. International aid has helped, but is currently not enough to battle the famine and the healthcare needs of the people. Food shortages continue to be a problem and affect the lives of the people and the children throughout the nation. Leaders are aware of these issues, but do little to help the people. The nation is in dire need of help. While the country has almost total control over its residents, including children, doctors, and all healthcare staff, international support could potentially help the people of the isolated country of North Korea. A long-term goal is to decrease the prevalence of malnutrition from its current percentage, 43%, in half to about 22% over the next 10 years throughout the entire country, using international support from the World Health Organization and nonprofit organization, the Christian Friends of Korea. A short-term goal to be achieved within the next year is to establish resources to obtain food items such as rice and other goods to deliver to areas in need. Regarding the improvements of hospitals and healthcare facilities, long-term goals are to maintain the electricity in these clinics, improve infrastructure within the next 10 years in 80% of the facilities, being hospitals, equating to about 1,900 hospitals, and clinics equating to about 4,500. Short-term and long-term goals are to improve the medical supply and vaccinations in all healthcare facilities using funding from the World Health Organization, the CDC, which can be administered within the next 2 years. Partnering with Doctors Without Borders and collaborating with the healthcare physicians and staff in North Korea, they can be trained to give proper techniques and methods for the supplies given to the facilities. Knowing how to properly perform procedures and dispose of medical equipment in a safe way can save lots of lives of North Korea. The government could potentially reject the aid given in my proposal due to their belief of self-reliance and their rocky relationship with the United States. It is important to emphasize the benefits of the programs to the government when providing this aid. The future of the nation, although typically rests in the government's hands, can be improved with international support. We want to see a decrease in malnutrition and the health of the children improve, as well as healthcare facilities and clinics improve, saving thousands of lives throughout the country.